And I think it's still important to ensure that you consider each person uniquely, because no matter how much I know or the nurse knows about the population, everybody is a little bit different. So I think it's really important to personalize every approach and kind of ask them what they know and meet them where they are.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Oncology Clinical Specialist at ONS, and today we're talking with Reneé Kurz, Director of Clinical Research Operations at Rutgers Cancer Institute of New Jersey, about increasing diversity in clinical trials. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks for joining us today, Reneé.
Thanks for having me today, Jaime.
So to start things off, can you briefly explain the issues just surrounding the lack of diversity in clinical trials and why that affects patient care?
Sure. Some of the issues, of course, involve mitigating inequalities and how that comes by ensuring proper representativeness in clinical trials. We're a diverse culture and population, and we want to make sure everybody is represented. But even more importantly, I think it is ensuring fairness and that all community members receive cutting-edge access. By ensuring access for diverse populations, we also promote trustworthiness within the diverse communities that we serve.
Thank you for that. I think that's a really great place to start our conversation with today, and thinking through not only does it potentially impact the results that we get, depending on how diverse our population is in whatever individual study you might be looking at, but it's also a matter of ensuring that all members of our community and our population have an opportunity to engage in that clinical trial if it's something that they are eligible for and it aligns with their values and their interests. And so it's definitely a twofold concern that, has significant impact on outcomes. So let's shift the conversation. Can you just give us an overview of some of the changes that are necessary to ensure that we can get a diverse range of populations represented in our clinical trials?
I think this is a really important question and something we have to consider before the study is even written when we think about the inclusion and the exclusion criteria. So if we look at it from the beginning, we can ensure that all populations are represented. One of the things we do at the Rutgers Cancer Institute is we have a member of our community outreach and engagement board sit on our scientific review board. So every protocol that goes through and gets reviewed, we look that it adequately meets our catchment area and has proper representation. And I guess after that, once the protocol is approved and goes through scientific review board, once it goes through the IRB, we automatically translate all the consents into both Spanish and English, which are our two most popular languages. And then furthermore, there's still many other languages that patients speak that are not included there. So after the study is open, if we have a patient that speaks something else, we're really committed to utilizing short forms. And our institutional policy is that we can use those 5 times before we can complete a full translation. So if someone speaks a language that's not as common, we can use these short forms up to 5 times. And they can be turned around quite quickly. We have a contract with an agency that turns them around in a couple days. And then our Rutgers IRB is committed to turning these around quickly as well. So that helps, include more patients right out the gate.
That's a great idea to consider how, if you have clinical trials at your institution, what is your process? The listener can ask themselves, what is my process here if we needed to create a consent form that was in a different language? If that's the barrier for a patient participating, how quickly can we make those changes so that's not what prevents them from participating? I think your original comments were also very interesting, just thinking through when that protocol is developed. I mean, and this is more on the sponsor or the scientific team of, as they're writing that protocol in preparation for submission, thinking through what is required inclusion and exclusion criteria, and also procedures, timing, those types of things can sometimes create barriers. Now, certainly there are clinical rationale for certain patient characteristics of being included or excluded. And sometimes there's reason for that. But if you're writing the protocol and it requires like everyday visits or something like that, you just have to think through, like, is that really what's required to get the information we need to study whatever it is the outcome we're looking for? Or is there a different schedule of procedures or tests that might be reasonable that also not create maybe that additional barrier of transportation or frequent visits? And so I think that's a really interesting piece of clinical trials that sometimes by the time it gets to the nurse who's on sort of the front lines of either enrolling or helping with administering treatments as part of trial, like that certainly is beyond our sphere of influence, but it's just something to think about as those protocols are written. Are there things that need to be considered? And it sounds like because you have that sort of community representation on your IRB, hopefully they're thinking through some of those things as well as they're doing their part of the review to make sure that if there's those types of details and stipulations in the protocol, just asking the question of, are they clinically necessary, or is there some other way that potentially that trial could move forward that would be a little bit more inclusive?
Yeah, it's unbelievable the things that the community brings up at the scientific review board, things that the scientists or the investigators would never think of. It really has been invaluable.
Sure. And that's great. I mean, that's exactly what you want. I don't think anyone faults scientists and physician scientists of like not thinking of every possible thing ever that could be considered. I mean, that's why we want that collaborative kind of committee approach so that everyone and their sort of priorities and their lens can be incorporated into how that protocol is developed and finally approved to make sure that it is mindful of all the various needs and wants of everybody who's part of the whole clinical trial process. So that's a great example. So can we discuss a little bit about the different ways that your institution is working to ensure diverse representation in clinical trials? So let's start maybe with the clinical research studies being offered at some of your partner hospitals, and how does that affect the study population makeup?
Well, as you know, New Jersey is quite a diverse state. And even though we're a small state, we're certainly densely populated and different demographics make up the whole state. So we offer our clinical research studies at 13 locations throughout the state, some in the north and some in the south. And by really opening up those studies, it makes it easier for patients to access it closer to their home and in their community. And that has completely changed a diversity in our clinical trial enrollment. For example, in 2017, 27% of our clinical trial enrollment was made up of diverse populations. And in 2022, this number was 45%. Even in just the last year alone, our clinical trial enrollment at the community locations was up 300%. So really by opening the doors and offering some of these cutting edge trials at the community locations where patients live, it's really enabled us to get a much more representative and diverse population.
Those are some amazing statistics that you shared. And I think it just, again, highlights how sometimes the biggest barrier can be just physical proximity, location. And as you said, New Jersey, relatively smaller state. So imagine the issues that would present for average size states, really large states. I mean, that distance can be what make or breaks a patient's interest and willingness and ability really to participate, even if clinically it's the right thing for them, maybe the best choice for them to move forward in their treatment. But those environmental barriers are real and really can present challenges to quality of life if you're spending all of that time either on the road or staying overnight places just to have proximity to where that trial is taking place. So that seems kind of like a simple, although I know it's not simple at all to change where you're hosting those trials, but such a small change relative, but how big of an impact that has for patients. So that's wonderful to hear.
It makes a big difference. I was just asked yesterday a question about reimbursement and the 65 and older population. And I said, we can give them more gift cards and more stipends, but what they really want to do is watch their grandkids on Tuesday. So if we can have the clinical trial open closer to their home and meet their schedules around that, it just makes it much easier for patients to participate, especially when they don't feel well to travel so far.
Absolutely. And that's a great example of just giving people what they really need and what they really want is, quality of life and quality time with their family and just being at their home and being comfortable. So wonderful example there. What are some of your institution's other internal resources for researchers?
We recently kind of have a centralized education team for clinical trials, and all the new investigators get a toolkit that they can use and get training on different informed consent processes and different resources that we have. We also have a really good relationship between research and our community outreach and engagement area. They actually attend and present diversity accrual data at each monthly staff research meeting throughout the state, and we make this a priority. They also have a dashboard that they've devised so investigators or staff or nurses can go on anytime and see where the minority accrual is at each institution throughout New Jersey. And if either the research nurses or the investigators come up with any barriers to enrolling a specific population, there's an online request that they can request community outreach services for their patient or for their location that they're at. Some of these requests have resulted in some really interesting projects. We had something called the Count Me In campaign, where we had posters placed at each location discussing diversity and clinical trials recruitment. We had another site that requested a clinical trial video discussing myths in clinical trial recruitment and benefits for the patients. This video was placed on loop in a lot of the waiting rooms at some of the facilities. We have our clinical trial brochures printed in 20 different languages. And depending on which location you go to, whatever languages are most prevalent, it's certainly on front and displayed, but we have others that are easily printable as well. And these are all things that were really brought up at these monthly meetings between the nurses and the community outreach engagement staff and the other research staff.
That's really amazing to hear. And, I'm struck as I listen to you respond, it's just that I have a very small history of minimal involvement in clinical trials, but enough to know how complex they are. And just the internal infrastructure and logistics of standing up a clinical trial, of collecting the data and doing all of those things, like that in itself is complex and it's challenging, but it's all for naught if you don't get patients to enroll. So it shows how important putting just as much effort into spreading the word, making sure people understand within, your institution, or if you're in a health system or you have a network of hospitals, doing what you can to make sure that it's easy for all of these sites to understand, okay, what trials are open, what are the eligibility criteria. It's a very different setting if you are at that academic institution and you only work in the breast program, for example. You probably know all the breast trials that are open because you are so hyper-focused on that one thing. But when you broaden that to a community setting where it's general medical oncology and various diagnoses that are coming through the door every day, to keep all of that information top of mind is nearly impossible for our nurses and physicians alike. So I think I really appreciate what it sounds like your institution has done to try to keep the communication flowing and current so that it's not a lack of information that creates the barrier. So we talked a little bit about this earlier, but are there any additional steps that your institution has taken to ensure that protocols are inclusive?
A major step really is the scientific review board going through before it gets submitted to the IRB, each protocol, making sure that the catchment area is really represented and that our protocols are inclusive. If we have the investigators out the gate develop a plan to involve diverse populations, and often it's diverse sites. Sometimes it's going through the scientific review board and they think, oh, wait, maybe this protocol should be open at a location that they didn't even consider. That really helps make sure that it's more inclusive. And we also have these disease-specific group meetings in addition, where the investigators and all the research staff sort of meet to discuss new protocols, and they discuss what would be the barriers to opening at specific locations. And I think that helps too.
Absolutely. We know that lack of public awareness is another barrier for recruiting diverse populations in clinical trials. So what types of promotional strategies has your institution found to be most effective to sort of increase that community awareness?
Yeah, this is definitely a big issue, especially since we're just now opening clinical trials at these community locations. A lot of the public and the communities don't know that you can go to your local hospital to get these cutting edge treatments. So we've hired 2 patient educators, we call them, and they do a significant amount of community outreach. They go to local churches, they go to pharmacies, they go to libraries, and they in general just talk about clinical trials and the availability of clinical trials. They definitely have had a marketing campaign between Rutgers and Robert Wood Johnson Barnabas advertising that there are clinical trials closer to home. So I think that's helped too. But these community outreach workers have really made a lot of difference. It's amazing how in some local communities, the pharmacy and the pharmacists really do provide a significant amount of information. So letting them know about what studies are open, Another thing that we've employed is the physician outreach team when they go see local physicians that are not oncology based, physicians out in the community, letting them know that we have these clinical trials available to their patients has been really helpful as well.
I suspect part of the education is not just that, we have this trial available for your diagnosis, but also helping to educate patients on what clinical trials are and how they are run and what will it mean to be part of one. I think there's still lots of myths and assumptions made about what that means. There's the whole quote unquote guinea pig. I don't want to be part of some experimental thing. And so there's a barrier to overcome of just like a lack of knowledge and understanding of what it means and what will that experience be like. And certainly that can be part of once a patient agrees, but typically you have to address that barrier before they'll agree. And so helping to, improve literacy and health literacy about what it means to get treatment as part of a trial, I think is a huge barrier that we have to continue to work through with our patients. So another thing I think we've addressed slightly, but certainly worth repeating is clinical trials. Once we learn about them, maybe the patients understand what they are, but there can still be that barrier of language. And if the patient doesn't speak English as their primary language or they have limited English proficiency, that can still remain a barrier. So what has your institution done to address limited English proficiency in patients who are interested in clinical trials?
I know we talked about translating everything, and I mean everything we translate. I think sometimes we run into a problem with studies and some of the questionnaires. It's easier to translate the consents, but sometimes these approved questionnaires are a little bit more tricky. And sometimes quality of life questionnaires are a big part of oncology studies. So getting those translated or thinking about those up front is something we've been working on. But I think we also have a very diverse staff, and we're really committed to having the staff representative of the patients that we serve too. So currently we have about 200 FTEs in the department, and 40% of our staff speak multiple languages. And this is not something that we got to overnight, really. As we continue to roll out research in the communities, it was a real commitment to hire folks from the communities that we serve to work in the research department. It involved a lot of training and education and outreach, and it's been very successful, let's say.
That's amazing. And I think that just highlights the importance of, patients like to see themselves reflected and their community reflected in the places they go for their healthcare. It helps them feel more connected, likely better understood. And so I think it's important to create diversity, not only in the trials we're trying to recruit for, but in the people who are doing the recruiting. And so seeing that community reflected in the health institutions that patients are coming to for their care, I think can only be a good thing. So that's great to hear that that's been, an intentional push from your organization. Well, Reneé, I think we've talked about some really interesting things for people to consider in terms of their own clinical trial programs and, ideas or initiatives that they can consider implementing to help increase the diversity of their clinical trial populations. But as we wrap up our episode today, I do like to ask a few of these sort of quick fire questions. So to start things off, how do you think nurses should evaluate their implicit bias when considering clinical trials and diversity?
I think they have to take a step back and figure out what they know about the communities that they serve. They're used to being on the front lines and seeing patients every day. What kind of experiences have they had with the community, or what do they know about the community, and really what the communities know about clinical trials, because a lot of it is going to be the nurse educating them. Most patients really don't know a lot about clinical trials. And I know you've kind of referred to before as the guinea pig. I think that that's really important. Do the nurses, do they know that they're going to get the best standard of care, plus or minus maybe whatever is additional? And again, what do they know about the population? And does the population know that? Because we really have to educate them. And I think it's still important to ensure that you consider each person uniquely, because no matter how much I know or the nurse knows about the population, everybody is a little bit different. So I think it's really important to personalize every approach and kind of ask them what they know and meet them where they are.
I love that. That's a great recommendation. What are some common misconceptions about clinical trials and diversity?
I think one of our old misconceptions that we're still kind of dealing with is that Medicaid patients or undocumented patients can't go on study. I mean, that coverage was just expanded last year. So it's newer that Medicaid pays for clinical trial treatments. So I think that word isn't widely spread yet. And even the Medicaid patients, it's actually sometimes easier now with this new law in place. to put them on study, a lot of those peer-to-peers and those pre-authorizations that nurses sort of get involved in so often don't always apply because it's paid for. So I think that's something important to know. And even with undocumented patients, I think a lot of these patients can go on charity care, and then the actual study procedures are usually what's covered by the clinical trial. So the standard of care procedures would be covered by charity care or Medicaid, and the actual study procedures are covered by the clinical trial. So I would say we shouldn't count anyone out.
That's great advice. And I think those are important questions that our listeners can explore with their own institution to find out, the hypothetical. If I have this patient who has this insurance or they're undocumented or whatever your concern or question is, ask around, find out that information so that you can not only know the right answer and that will help prevent any miscommunication, but then you can share that information with your colleagues so that everyone benefits from having the accurate information in response to those scenarios. What's something about this topic that's not often discussed, but you wish people knew more about?
I think still the biggest thing is back to that guinea pig comment. Patients still assume they're getting a placebo. And when they see a trial with blinded arms, they tend to get pretty nervous about that. So really to reassure them that they are going to get the best standard of care treatment possible. And usually it's plus or minus something else. But also I think it's important to really encourage them and let the patients know that they can withdraw at any time. This is totally voluntary. And if they change their minds, no questions asked, they can come off study.
I think those are some great things to keep in mind. And I think for those of us that have proximity to or have worked some close to clinical trials, some of that information we've picked up along the way and we get it. But I think it's fair to say that sometimes our colleagues, our teammates may not know all the details of clinical trial, especially if they don't work exclusively in that space. And so even though we might share an office building or a place where we do our work, it doesn't mean that we all speak the same language. And so I think learning more about what those clinical trials mean, what are the different phases, what are the intention of those phases of trial and the outcomes they're looking to measure, that's important because that translates down to the information and the education you share with your patients. So try to improve your own understanding if you feel like there's some gaps in what you understand about a clinical trial, because that can only benefit your patients. And it's something that we need to make sure we can speak to confidently about with our patients. What's some additional training or education for oncology nurses to better advocate for diversity in clinical trials?
I think that the oncology nurses overall, we are better educated on clinical trials than some of our non-oncology counterparts, just because we have so many oncology patients in clinical trials, but we still have a ways to go to really understand the informed consent process a little bit better, to really understand what's open and available at any given time, the difference between phase 1 through 4 studies, and also the difference that certain treatments open and close quickly. There's windows that we have to abide by. And if a patient is on clinical trial, it's just so important that we get all the study procedures in a timely manner really done. So if there's a diverse population, that they know when their future appointments are, that they have a way to get to their future scans or images, because you don't want to compromise the study or help the patient to stay on study. Pill diaries are another thing, really helping the patients understand, to return them and the need to take them as ordered. So I think a lot of oncology nurses really just have to help the patients navigate, which is this complex system, which is something so common in oncology.
Absolutely. And I think sometimes you can just start with, I know that I've gone to clinicaltrials.gov. That's just one repository of clinical trials that are available. And they have tools to help you learn how to read that study record and understand, what is this telling me? What are eligibility criteria? Walking through the entire record that's listed there on the website. There's a lot of information there. It can be overwhelming. And imagine if it's overwhelming for you as a clinician, imagine what a patient must feel like if they stumble into that website. And so it's a great place to start, just to familiarize yourself with what kind of information is there and, what more do I need to know so that I can kind of translate this and have it make sense for the patients that I'm caring for. So what are some additional resources for patients or providers who want to learn more about clinical trials?
I think the first one would probably be city training. Some of us have done it that are involved regularly in research, but some nurses who are treating patients haven't. So city training provides a great overview, really, of some of the basics that we kind of even talked about today, and really is something that we can all do. And there's different modules that you can pull in depending on your institution. clinicaltrials.gov, of course, you just mentioned that. Great site for whatever clinical trials are available. And also the ONS Manual of Clinical Research is a great tool as well.
Perfect. Actually, I just was preparing for a presentation about the FDA and the kind of the phases of research and the steps of drug approval. And so lots of information on the FDA's website just about what that process looks like. It's less about the trial. It actually goes into detail about the trial and how those trials are set up and how those meetings with the FDA progress through all of that. But lots of great information there too, just as a primer sort of on kind of how compounds and things go from infancy all the way through development into human studies and beyond. So I think all the examples you provided as well, it shows that there's plenty of information out there. And we will be sure to include many of those links in our episode notes today so that we can make it easier for our listeners to find those and follow their interests. Well, Reneé, thank you again for your time and your information that you shared with us today. Do you have any final comments for our listeners?
I just want to thank everyone for listening and supporting clinical research. And if we really subscribe to the notion that clinical research affords the best care to our oncology patients, then I think it's just so important for nurses to advocate that minorities and underserved populations really have access to these important therapies.
Absolutely. Well said. Thank you so much, Reneé.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.